I'd be remiss if I didn't talk to you a little bit about, yourself and your experience with healthcare.
Okay.
Get some background knowledge. So, where did you start precisely in healthcare?
My first exposure in healthcare was when I became a nursing student. Before that, I didn't have any exposure. My dad's a physician, and my mom
Okay.
was a nurse.
Oh, okay.
My dad was actually a nurse practitioner before he was a physician,
Oh, wow.
and he was a scrub tech before that.
Fascinating.
But just being introduced to healthcare by them, and then my dad went to medical school late. He went when he was 40, so my brother and I were both alive. I think I was about 8 years old. 6 years old, I think, when he got accepted to medical school. So we kind of went through that journey with him.
Wow.
I definitely remember sitting in giant lecture halls with him
Yeah.
sometimes because there wasn't anyone to watch me when I was younger. But until I actually got into nursing school and then became a nurse, with rare exception, I really had no exposure to healthcare.
So, this is interesting. I actually kind of want to unpack a little bit about your dad real quick. So, your dad was a nurse, right?
He was a scrub tech,
Scrub tech,
and then
registered nurse,
then he became a RN.
then a nurse practitioner.
Well, then he became. This was in the 70s, so
Okay.
he was a certificate nurse practitioner. He was a advanced practice nurse, an APN.
Oh, APRN.
Yeah.
So, advanced practice registered nurse. So, like, I've heard of those kinds of nurses in some states being allowed to like write scripts of
Yeah.
like very set,
Again, it was the 70s, so
Oh,
they
it
had
was
more
more.
power. But
Awesome.
yeah,
Okay.
it was in California. Yeah, he did patient exams. He prescribed drugs. He did many things.
Was it with a physician co-signature at that time?
It was with a physician
Okay,
co-signature.
so it was like a physician's assistant kind of position,
Yes.
kind of certification.
He also actually was a physician's assistant as well. He didn't work as one, but at the time it was another certificate program, so
Wow.
he just got the certificate, so you'd have options.
Cool. Wow, things were so much nicer back then, weren't they?
Very
Before
easy.
Overregulation.
Yes.
Yeah, and then he went to medical school after that and became a full-fledged physician.
Correct.
And what's his specialty?
He's family practice.
Awesome. Very cool. Okay. And so, yeah, that's a pretty deep medical background. Your mom was a registered nurse, right?
My mom was a registered nurse.
Okay.
All of my dad's fathers and grandfathers were physicians.
Wow.
I think my grandmother on my mom's side was a nurse, and then most of her family was attorneys, but there were some medical people in there.
Wow. Okay. And so your first exposure to healthcare was in nursing school at what age?
20?
Okay.
21? 21.
21. All right. Well, what was the most interesting or shocking aspect of it as a nursing student?
Jeez. I guess that just people die every day. How sick they are.
Yeah.
You come in and I mean, these people are sick. And you really don't think about it. You see it on TV, like back in the day we watched ER or whatever, and those people are sick, but they all walked out. These people, yeah, they don't walk out as much.
Yeah. I mean, that's one of the biggest differences I've seen between healthcare providers and the general public is that we see it constantly and every day and everywhere. And the general public's exposure to it is generally like one of your friends or family members gets sick or goes to the hospital.
Right.
And a lot of times, one of the most interesting things I've observed recently is that it's not really until people are in their late middle ages that they start to have a lot of contact with the healthcare system.
Right.
Because of their parents or older relatives starting to die or get very sick. And so it's interesting that you can go through, the majority of your early life with no exposure or rarely going to a hospital, other than maybe for the birth of a child or something, or a friend getting a really bad pneumonia maybe.
Maybe.
But with no exposure at all. Yeah, it's strange that it all kind of just slams you at once in like your mid 40s, maybe even your late 50s. So that was nursing school for you. You graduated with a bachelor's degree?
Correct.
So you had a bachelor's of science of nursing, and you were a registered nurse.
Yes.
Right off the bat.
Yes.
And you start working where?
I started working in I had 2 job offers. One was for cardiac ICU, and the other was for telemetry.
Okay.
And the telemetry was a very good interview. I really connected with the person interviewing me, so I took that job. And I was there for 3 years. Um, the first year I just worked as a nurse. The second year I was a charge nurse, and the third year I was a nursing supervisor.
Wow.
Yeah.
That's quick moving.
Yeah.
Yeah, that's nice. Yeah, so just to expand, telemetry is where you go to the hospital, you're usually on a regular floor, but because of some cardiac abnormalities or maybe electrolyte abnormalities, for some reason we want to monitor the electricity in your heart. So we put a little pack on you, right?
Yep.
Yep, we put 5 little stickies on you and a little, usually a portable battery pack that transmits the electricity flowing through your heart to a monitor, and then we can monitor that constantly there. But it's not the kind of really intensive care that you'd get in an ICU.
Yeah.
So you moved from telemetry, being a supervisor in a telemetry unit, to...
Outpatient endoscopy.
All right.
So colonoscopies, which are from the bottom up, and then upper endoscopies from the top down.
Okay.
And we did several other procedures too. But yeah, I worked in a private physicians group. They owned a center. Actually, they owned 3 centers where we did these things every day.
Okay. And that's where, correct me if I'm wrong, but that's where you take like a fiber optic scope, right?
Yes.
So it's this long pole that can bend around, like if you watch Mission Impossible and you see him looking under a door with a camera. That's what we put either into your rectum or your mouth.
Correct.
Hopefully mouth before rectum if we're doing both. You take the scope, and you insert it down. There's a camera, and then you can also insert tools in there, right?
Yeah, they have a port that goes all the way through that you can put something in one end and it'll go all the way through and come out the other end.
Okay. So, and with that, you could like lavage or suction or maybe even minor surgery or something like that?
Yeah, we can go in and we can take samples. We can apply rubber bands to things. Cool. We can put alligator-style clips on, like a clothespin, kind of. There's a basket you can put through there. There's a net you can put through there.
Wow.
It's for retrieving things.
Okay.
Pretty much anything you can think of, there's a tool that can go through one of these scopes to do that.
Fantastic. But primarily for initially diagnostic purposes, for diagnosing like bleeds or like diverticuli or tumors, those kinds of things, right?
Yeah, no, that's the whole point of them.
That's the whole point.
To go in and see what we can visualize.
Yeah, and then secondarily to try to fix those problems that you can fix. Those problems.
They may be fixable through the scope. They may not be.
Sure.
If a tumor is too big, you can't.
Or if there's a bowel perforation, maybe.
Right.
You need to actually open somebody up and suture.
Yes.
Okay. Very cool. And was that outpatient setting?
It was outpatient.
Excellent. All right. How do you like that job?
It was really fun. You see all sides of it. Sometimes you're in pre-op, sometimes you're in the procedure itself, and sometimes you're post-op. So it's high-paced, and people are always moving.
Do you have any interesting stories?
I mean, I've seen a lot of colons. I think the most interesting thing that I saw was, if you look it up, it's called melanosis. And so it's actually something that occurs when you take too many stool softeners. Oh. And it irritates your colon, so it turns black. Normally, it's a pink color.
Okay.
If you look it up, melanosis.
Is that from necrosis, or it's just
pigmentation
change?
It's
right?
pigmentation change from long-term stool softener usage.
So, like if you're taking Colace or Docusate.
Yes, and you take it every day for 10 to 15 years, or 5 to 10 years, or even a year, your colon can turn black. I can only imagine it's from chronic irritation from things moving through all the time, but I don't know.
Is there like a degradation of the internal mucosa?
No.
So
the mucosa is fine.
No absorption problems?
No absorption problems. It turns black.
Wow. That's interesting, Mike.
Yes.
Melanosis?
Melanosis.
Fascinating.
Then other than that, I mean, I've seen all manner of tumors and what have you. we actually this wasn't in the outpatient center. This was in the hospital. But I also saw one where we had to pull somebody's key fob for their car out of their esophagus because they tried to swallow it, and we were able to do that with the scope.
Okay.
Obviously, we couldn't pull it through the scope because it's
Yeah.
bigger than the scope.
Oh, yeah.
But we put the tool through and grabbed it and then pulled the whole thing out.
Wow. Okay. Yeah. Weird stuff happens like that
Yes.
frequently. Yeah. When I worked in psych, the big one that for some reason a lot of psych patients like to swallow was batteries.
Yeah, I had a patient swallow a cell phone battery.
Yeah, and all I can think is it's because it's like a guaranteed ticket out of, whatever psychiatric hold facility they're in at that time. Because you swallow a battery and battery busts open, you probably can't pass it, right?
No, I mean, you could. It may hurt your
Maybe,
bowel.
yeah.
You're probably getting surgery.
That'd be a tight squeeze through a pyloric sphincter.
Yeah.
But yeah, if it busts open, I think it's hydrochloric acid in batteries or something like that. No, that's stomach acid.
Stomach acid is hydrochloric. I don't.
There's myriads of acids probably that are in batteries, but that's interesting. So you moved from telemetry, where
Yes.
you climbed the ranks to supervisor,
Yes.
to outpatient endoscopy,
Yes.
and then from there, where did you go?
And then from there, my wife got into law school here in Phoenix, and I had been in Reno previously. So we moved here, and I got a job in the medical ICU
Okay.
at this hospital I presently work at. They didn't really. Now it's also, we have the neurosurgical ICU. When I got there, that really wasn't a thing. We had a neurosurgeon,
Okay.
but very few things happened with it.
Gotcha. So, how many years were you just primarily medical ICU specialized?
About a year and a half.
Okay. And that's when the transition
And
started.
then they recruited a very skilled neurosurgeon, and they wanted to broaden their neurosurgery line. So we then opened the neurosurgical ICU.
Okay. Yeah, and that's when the certification for stroke center came about, I'm guessing?
No, the primary stroke center certification really just says we give people TPA.
Oh, that's it.
And we monitor it, yeah.
Oh.
And we follow up on things.
So you don't even need like a neurointerventionist or cath
No.
lab for that?
No, so that's actually that primary stroke is TPA. Complete stroke means you have a neurovascular lab where a surgeon can go in and pull a clot out or put a little bit of drug into there. And then comprehensive would be the next step, which has some other things. You don't gain any further treatments. You just have MRI 24/7, and you do a lot more research on it, and you have enough cerebral aneurysms that you repair to meet the minimum that they require.
So I'd imagine a facility like that out here would be like St. Joseph's with the Barrow Institute.
So there's actually, until recently, there were none.
Okay.
Now it is Banner University
Really?
is the only one,
Okay.
and we actually meet the minimum requirements for it. We just need to have 24/7 MRI and
Sure.
24/7 neurointensivist, because that's another
Oh, okay, so we need another on-call neurointensivist then.
in the building.
Oh,
In the building.
okay.
In the building, 24/7 MRI, in the building,
Okay.
neurointensivist. And there's a couple other things, but those are really the main hurdles. But it doesn't add any actual ability to do anything procedure-wise to help patients. It's just a monitoring thing.
Okay. Yeah, so you spent the majority of your adult life working in acute care then?
Yes. Yeah, I graduated when I was 23, and I'm now 33. I've been working in acute care essentially that entire time, with the exception of about a year in outpatient endoscopy.
All right. Overall, how would you rate your experience?
In healthcare,
Yeah.
hospitals are big corporations, and like any big corporation, they don't care about their employees. Unless it's Microsoft. If you're looking to be treated well by a company, don't go into healthcare.
Yeah, there's an amount of I'd say expectations that will alter like what people consider a normal life. So like we just are finishing the Christmas holiday break right now, and most people in most normal jobs, 9 to 5s, have the entire 2 weeks off, or at least a week and a half.
Yeah.
My wife, who's an engineer, has I think 2 weeks off total. Juxtapose that to me, I've been working 5 days a week, if not 6. And this was the first Christmas off I've had in 5 years, actually.
Yeah, you're guaranteed to miss every other holiday every year.
Yeah.
For the entire time you work in healthcare, essentially.
Yeah, yeah.
If you had Christmas off last year, plan on working it this year, and then if you like to work or need to work, you can plan on missing every holiday.
Yeah. And the minimum of 2 weekends worked every month as well.
Yeah.
Yeah, so that's pretty life altering in terms of, how you can interact with normal people, I guess I should say, non-healthcare. But I mean, it's not because the scheduling issues aren't necessarily because companies hate us. I'd say it's more because it's a 24/7.
Yeah, no, scheduling is medicine or nursing. It's 24/7, 365.
Yeah, yeah. There's not an opportunity to just
It's
shut
not
it
just nurses, it's physicians too. The only people that don't work that are the business people.
down. Yeah, the administrators.
They get regular hours.
I'd suspect a little more money too.
And they get a lot more money. They get a lot more money than the physicians even.
Yeah, it's interesting how that all works out. Okay, and so where are we going in the future, Mr. Mike? What are we going to
Right now I'm working on getting into nurse anesthesia school, which is like a nurse practitioner to an anesthesiologist.
do? All right.
Yeah. And so that would hopefully be in the near future.
Yeah, so with that kind of job, you'd be like the anesthesiologist
Yeah.
in surgeries, right?
Yeah, I would be the person in the surgery, putting them to sleep and keeping them alive through the surgery,
Sure.
and then waking them up.
Or you could go back to, acute endoscopies,
Yep.
and you could be anesthesia for those.
Yeah, anywhere that you can provide anesthesia, I'd be able to do it.
Fascinating. And so let's just go over your education real quick. How many years did it take for you to become a nurse?
So, let's see. I started college in 2002 when I graduated high school, and then I was done with my prerequisites in December of 2004. So I did about, 2.5 years or 2 years of prerequisites, and then just shy of 2 years of nursing school. So it was about 4.5 years of college.
Wow. Okay.
And then your education doesn't stop there. I much later got my critical care registered nurse certification,
Yeah.
and a self-study thing for that, but that took some time. And trying to get into nurse anesthesia school, I've gone back and I've actually I had to retake 2 classes at undergraduate level to bolster their grades a little bit, to be a little bit more competitive. So I've seen my fair share of campus life.
So cumulatively, probably 5 going on 6 years
Yeah.
right now.
Absolutely.
And looking forward to how many more years?
If it's a master's program, 24 months. If it's a doctoral program, 36.
Okay.
So another 2 to 3 years or so.
So be coming out of all of this with your final career, is this what you hope to be it?
Maybe?
With 8 to 9 years of education under your belt, right?
Yeah.
And probably what will be up to about 13 to 14 years of actual experience working too.
Yep.
Yeah. So that just gives you, everybody that's watching, an idea of how much knowledge or study or dedication is required to do what we do, so we have the opportunity to work every other holiday and every other weekend.
Yes.
Yeah. All right. Anything else you wanted to add, Mike?
No, I think I'm good.
All right. Thanks for coming.
Absolutely.
Really appreciate it, man.
My pleasure.